Good afternoon. I'd like to begin again by highlighting some of the big picture trends we are seeing here and talked about a bit at last week's briefing. We're continuing to see increases in COVID-19 cases in many parts of the state. Informal gatherings in COVID-19 We're continuing to see increases in COVID-19 cases in many parts of the state, and informal gatherings and get-togethers are contributing to those increases. This places everyone at high risk, most of all the loved ones we care about and those in our community who are older and have chronic health conditions. A spike in cases will jeopardize our progress towards reopening and could overwhelm our hospital capacity here in Washington state. Other states are already seeing strain in their healthcare system, and here in Washington, we're starting to see increases in hospitalizations. Dr. Lofi will share more about this later in the briefing. For now, I want to emphasize that it's not too late to reverse these trends. Each of us can take meaningful steps to protect our friends, families, and communities. This is a critical moment to recommit to the actions we know prevent the spread of COVID-19. As I mentioned, gatherings and get-togethers are contributing to our cases here in Washington state. Recently, friends and family gathering to watch their favorite football team led to an outbreak with at least 6 cases of COVID-19. If you're planning a get-together, please wear a mask around people that you don't live with, even if it's friends and family. Remember, many people get COVID-19 from someone who doesn't have symptoms yet. And higher rates of COVID-19 in the community increase the chance that someone at a gathering could have COVID-19. Together, these make gatherings and get-togethers risky, even when we're with people we know well and trust. If you're going to get together, whether that's for Halloween this weekend or to watch your favorite football team, please keep your gatherings small and be outdoors whenever possible. This may mean bundling up outside when you get together to catch up with your friends and loved ones. Avoid indoor gatherings if you can, but if you must gather indoors, wear a mask and open the windows and doors to improve the ventilation and reduce your risk. Limit the number of times you gather with people outside of your household and keep your visits as short as possible to reduce risk. Of course, wash and sanitize your hands often and avoid touching your face with unwashed hands. Finally, and very importantly, stay home if you're sick or you've been exposed to someone who has COVID-19. I do want to note this weekend is Halloween, and we know that a lot of families and young children have been looking forward to this. Given where we are as a state, many families and communities are looking for safer alternatives to trick-or-treating. So here are a few things you can do instead of traditional trick-or-treating. You can do a candy hunt in your home or yard with your immediate household or family members. You can carve or decorate pumpkins outside at a safe distance with friends. You can hold a virtual costume party so that everyone can show off their costumes and maybe even also your carved pumpkins. You can do a candy exchange with families that you know really well, doing door delivery drop-offs. You can also organize a physically distanced neighborhood costume parade. And if you do decide to trick or treat, please stick with your household, wear a mask, and a reminder that even if your child's costume covers their face, it will not serve as a face covering unless it fully covers their nose and mouth. Watch your distance from other parties that are outside of your household and sanitize your hands often. When you wrap up your night, have your children wash their hands as soon as they get home and put aside their candy for 24 hours before allowing them to handle it. The chance of COVID infection from packaged foods is pretty low, but it is not without risk. If you want to make sure they have something for the big night, purchase a small amount of candy ahead and have that on hand so they can eat it when they get home Saturday evening. There are more tips for Halloween and safer gatherings at www.coronavirus.wa.gov/gatherings. If we act now and choose fewer, shorter, smaller, safer gatherings, we can head off this surge before it's out of control in our state. Let's stick with it, Washington, and continue protecting our loved ones, communities, and healthcare system. And with that, I will turn it back to you, Corey. Thank you.
Thank you, Lacey. Next, we'll go to Dr. Kathy Loki.
Good afternoon, everyone. As usual, I have a few slides I want to share with you, so just give me a moment so I can share my screen with you. Great. Well, good afternoon, everyone. I am going to show you some data that was just published today from our modeling team. It is in our situation report for the week that I believe was just posted a few hours ago. And I would just like to walk you through some of the data in this report. Which is a little different from normal. I'm not going to show you the data from our dashboards. This data is all available in the modeling report. The one thing I wanted to point out from the beginning is that this data, most of these graphs show data through mid-October. As you know, the past approximately 10 days of data are not always complete. And so our modelers really only like to show, the data where, we're really confident in the data. The data is complete. So this first graph shows the estimated reproductive rate in Eastern and Western Washington. And I think you all know by now that the reproductive rate is the number of people that will be infected from one given case. We want this number to be less than 1 because when the reproductive rate is less than 1, the outbreak gets smaller. When it's greater than 1, the outbreak grows. Unfortunately, around mid-October, the estimated reproductive rate was around 1.3 in Western Washington, indicated in the turquoise line, and was about 1.1 in Eastern Washington, indicated in the pink line. The vertical lines represent the degree of uncertainty. So the true point could be anywhere on that vertical line, but the best estimate for both Eastern and Western Washington is now greater than 1, which is not where we want it to be. Okay, this next slide shows cases and hospitalizations in both Western and Eastern Washington. The top graphs represent Eastern Washington data. The bottom graphs represent Western Washington data. And you can see in Western Washington throughout, September and early October, they've seen a really sharp increase in the number of daily positive tests. Those are our cases. And if you skip over to this third graph on the right, you can see that hospitalizations on the west side of the state are also increasing, which is very concerning. In Eastern Washington, the incline in daily positive tests is not as sharp as it is in Western Washington, but the same sort of upward trend. And then the hospitalizations are bumping around a little bit, but also appear to be slowly increasing. So this graph shows cases that are the epidemiologic curves for confirmed cases in every single county. And what I want to point out is that the recent growth that we are seeing in our outbreak here in Washington is really pretty widely distributed. So there's not just one county on the east side or one county on the west side that's accounting for the increase in activity that we're currently seeing. As you look across this slide, you can see that there are many counties that have that are in an upward trajectory. A few counties that I'm particularly concerned about are Snohomish. You can see that Snohomish is on a very steep incline, almost a vertical line. Pierce is also on a pretty, rapid increase, along with Thurston County and Clark County. But we're also seeing increases in a lot of our central Washington counties as well. But the increase is just not as sharp as some of these increases as we are seeing on the west side. So our modelers also break down our cases by age group. The top graph represents the age of the cases in Eastern Washington, and the bottom graph represents the age group for cases in Western Washington. And as you can see, we're seeing greater inclines in Western Washington among cases. And you can also notice that these increases are happening in almost every age group, with the sharpest increase happening among the 25 to 39-year-olds and the 40 to 59-year-olds. But concerning, we're also seeing increases in those over 60 when it comes to cases. This indicates that disease in the population is very widespread as well. So in summary, COVID-19 transmission is increasing across the state, but particularly in Western Washington. The recent growth in cases is widely distributed geographically, but also distributed among age groups as well. And transmission does continue to occur in multiple settings. Right now, we are particularly concerned about private gatherings, as Lacey discussed, but we are still seeing outbreaks in other, workplace settings as well. And I encourage you to take a look at our outbreak report, which we update once a week. And then lastly, I just wanted to point to some data that I discussed yesterday in the governor's press conference. The UW Institute of Health Metrics has on their website some projections about what we might expect this winter. And the red line indicates the number of daily deaths that have been reported here in Washington. This data is smoothed. And then you can see that this purple line indicates the number of daily deaths we might expect moving into the winter if we, keep our conditions as they are now. And what I wanted to point out is that they have predicted that if we are able to achieve universal masking, that is more than 95% of the population wearing masks all the time, we would see a much lower number of deaths every day going into the winter. And I just wanted to highlight this data and put in just another plug for the importance of wearing masks. Whenever you're with anyone outside of your household, this does not mean just wear them to the grocery store and wear them at work. It means to wear them during your break. During your breaks at work, to wear them when you're in cars with friends, and to wear them in your house when you're having people over from outside of your household. So with that, I will turn it back over to you, Corey.
Thank you, Dr. Olympian. Next, we'll go to Michelle Roberts.
Good afternoon, everybody. Like Corey just said, I'm Michelle Roberts, and I'm leading the COVID-19 vaccine planning team at the Department of Health. And as you know, there's a huge team and a huge amount of work laying the groundwork for distributing a COVID-19 vaccine when it's available, with the goal of hopefully saving lives. As you probably remember, last week we shared version 1 of our vaccine distribution plan. We also told you we were accepting feedback on that plan. We were accepting feedback on that statewide interim vaccine plan, and we've been getting lots of feedback on it, including around prioritization around the initial doses of vaccine. So this is a wonderful example of how the people of Washington State are engaged in fighting this pandemic together. We appreciate the feedback and hope to hear from more of you. You can view the plan and submit feedback on our website at www.doh.gov/emergencies/COVID-19/vaccine. I'm going to share a few other updates about vaccine planning in our state. First off, I want to talk about provider enrollment and helping to make sure we're ready to administer a vaccine when it's available. So not every facility is set up at the moment to deliver a COVID-19 vaccine. Part of helping health facilities get ready to do that is completing the enrollment process, including the readiness checklist, which is information we have on our website. Assessing readiness includes storage needs, temperature monitoring, and more activities. This morning, the department started sending out an official letter from the Secretary of Health and the state health officer to healthcare providers about how they can enroll as COVID-19 providers and what they need to be doing to be ready to do the enrollment. This is just the first step in setting up our approved COVID-19 vaccine locations. We're also thinking about people in congregate living settings and how to best help keep them safe. There's a different way for long-term care facilities to enroll to provide COVID-19 vaccine for their residents. On October 16th, the White House announced a federal partnership with CVS and Walgreens to distribute and administer the COVID-19 vaccine to residents in long-term care facilities when it becomes available. So we're really working to distribute this information to long-term care facilities across our state, and we're really encouraging them to strongly consider registering for this program. The next planning update is about new vaccine preparation timelines and some new planning requests from the federal government. In a letter on Monday, the Department of Health and Human Services said they may need to pre-position vaccine supply closer to the administration sites where vaccine will be needed once it is approved. This will make distribution easier and faster once approval happens. They've asked all jurisdictions, including Washington State, to plan to be ready by November 15th. We want to be clear, we do not know when we are receiving a vaccine. This is just a be ready date. It is not the date of when vaccine will be approved and ready. We want to reemphasize that any vaccine distributed in Washington State would only be issued after receiving federal approval. We must submit some additional planning to HHS by November 2nd to support this new timeline. Hospitals are the most likely pre-positioning site candidates in Washington, but nothing is final yet. We'll provide more information next week as we work on these new planning details and learn more from HHS. That's it for me right now, Corey.
Thank you, Michelle. Next, we'll move to Dr. Kira Massa.
Hi, good afternoon, everybody. Thanks for coming today. I'd like to talk a little bit about what's going on from a behavioral health perspective with COVID right now, and with Halloween and the holidays sort of approaching us and the election coming up next week. There's a lot of talk that we're hearing and discussion about emotion regulation and dysregulation that people are experiencing. And I just want to sort of normalize what's going on with that right now and share a little bit about the context for which we're having difficulty sort of responding in maybe a more logical or a more sort of planned way to some of the things that we're experiencing in our lives right now. There's obviously layer upon layer of things that people are being affected by. A lot of that has to do with balancing the various demands of work and home, the different ways in which the pandemic has affected all of our daily lives with kids and with changing work situations and that kind of thing. And all of that upheaval over time really takes a toll on our neurological systems and the way that our brains and bodies respond. Having the experience of stress in a pandemic for 7 months now really is an exhausting thing to go through for our brains. And one of the consequences of that is that the part of our brain that's responsible for sort of the logic and the filtering and the organization of our responses and our interaction doesn't integrate as well with the other parts of our brain. Another thing that's happening is that the part of the brain that is our emotional responder, the part that's constantly sort of scanning for threats and looking for where the next hit is going to come from, that part is more influential over how we perceive information and how we respond to information. And that's not just things that we read and see online, but interactions that we might have with family members, kids, colleagues, and friends, and that kind of thing as well. So emotion regulation right now is a pretty big struggle for a lot of us. And there are some things that we can do about it. So what's going on is that when our brain gets exhausted and it gets really tired with all of this cortisol and all of this stress, we go into sort of this threat scanning mode where we're looking for these next hits. And when that happens, we lose the ability a little bit to attend to positive things. We don't notice the positive things as much because we're looking for the next bad thing. So when we're focused on anticipating the next potential thing that we have to deal with, we're not as able to, sort of soak in and internalize the thank yous that we get, the congratulations, the positive kudos that we get from our work or from our interactions with other people. Our brains actually don't pay attention to that, and it doesn't process it in the same way. So moving forward, in terms of a thinking process that might be helpful for folks, I would really recommend taking a little moment, taking a little bit of time before responding and attending to those positive things. Because just giving that little bit of attention is actually going to make your brain more likely to soak it in and let it sit with you and sort of influence how you're feeling throughout the day. The other thing that you might want to notice is if your body starts to respond to something before your brain can catch up with it. The way that this looks is usually basic physical symptoms. You might get a tension headache. You might feel warm. You might notice that you're starting to sweat or feel uncomfortable, have tension in your chest or shoulders. When I'm talking with clients a lot, I'm reminding people to make sure to, keep their shoulders down, because as we get tense, we just sort of crunch up, and everything becomes more tight. That's really difficult. That's another piece of the exhausting process. So taking a breath and taking a moment before we respond is another way to keep the pieces of all of our brains sort of integrated and engaged in how we respond to other people. It's not something that we do automatically right now, because again, the automatic system that we have going on is sort of the fight or flight and the stress response of, scanning for the next thing and not attending to the positive and responding pretty impulsively. So when people are consistently responding kind of impulsively and that emotional center of our brain is really influential, obviously that can cause some problems, right? We're looking at that on a big social level. We're looking at that on a family dynamic level. We're looking at that sort of even within relationships and with colleagues at work and whatnot too. So if you get an email, your brain is more likely to perceive that email as being neutral or negative than it is to be positive right now. So it just requires a different degree of attention, and that's a little bit effortful, but it will definitely pay off. And emotion regulation is something that can be modeled for kids. It can be modeled for family members. And there's a lot of things that kids are struggling to learn right now. But I know I'm biased. My vote would be that if parents can work on their own emotion regulation right now, it's kind of like putting your oxygen mask on an airplane before you help somebody that's sitting next to you. If you can emotionally regulate yourself and model that for your kids and they learn that from you, that might be one of the most important things that they can learn right now too. It's a really helpful life skill that folks can have. Also keep in mind the way that your behaviors might be influenced by emotion dysregulation. So the likelihood of responding really impulsively, lashing out at someone, and then sort of taking a step back and saying, why did I just react so strongly to that thing? Those are things that we're all kind of managing right now. And the antidote for that is to pause, to let the thinking part of your brain catch up, reintegrate, filter your response a little bit and control it, and make a better decision about how to interact with somebody when you disagree with them or when you aren't getting along about a particular subject matter. So there's a lot that we can actively do to develop our own emotion regulation skills, to model that for other people, and just really to share this information and to recognize that most of us are struggling with this right now. And it's hard for everybody. And another consequence of that is that when we're so emotionally focused, the logical, organized, cognitive part of our brain is not as effective. So we're losing track of time, we're getting distracted and getting confused, and that's normal as well. So emotion regulation is going to be really important heading into the next couple of weeks for sure. And practicing these skills now for small things as well as large scale things is going to be beneficial across all the different roles that we play in our families and in our communities and at work as well. So something to consider. Again, I would refer you to the coronavirus.wa.gov/wellbeing website. There's a lot of resources there. And there's the crisis line that's available. If you're in crisis now and need somebody to talk to, 866-4-CRISIS, which is 866-427-4747. And yeah, check out the website for other resources about gatherings and ideas for the holidays that are coming up that Lacey mentioned as well. That's a great resource for folks. So I think that's it for me today. Thank you, Corey.
Thank you, Dr. Moffitt. With that, that'll complete remarks from our panelists today, and we'll move into the Q&A portion of the briefing.